Hi everyone, my name is Zarina Marino and I'm going to be discussing assisted reproductive technologies. What is art? Art can be a number of things, but specifically for the purpose of this paper, I discuss ovarian stimulation for IVF, which is the use of hormone treatment to stimulate or hyperstimulate ovaries to produce oocytes so that they can be harvested and then used for in vitro fertilization. Also, intracytoplasmic sperm injection, which is the use of a single sperm by a micromanipulator for implantation into a single egg, which has gained a lot of popularity. IVF has been the golden standard, but ICSI has been used now more frequently. Cryopreservation of oocytes in ovarian tissue. The hormone cycle process and the harvesting process of oocytes is invasive for women, so being able to harvest a large amount of eggs and preserve them for later use can really help infertile couples going through the cycle. And also in the United States, cryopreservation has been promoted commercially to young women who wish to delay motherhood. Also, gamete and embryo donation. There are about 500 clinics, art clinics in the United States as of 2016. This image shows the amount in 2014, and as you can see, there's a lot in the East and West Coast, not a lot in Middle America. As far as the reporting of art clinics, or like what they're required to report to the government, the first IVF baby was born in the United States in 1981. Prior to that, there was one born in the UK in 1978. But after that, there really wasn't a lot of reporting done from art clinics to the government. Most reporting was voluntary until 1992, when the federally mandated Fertility Clinic Success Rate and Certification Act was passed, and the first document showing success rates from different art clinics was published in 1998, so all relatively new information. Art has been used across different countries in Belgium, but due to discriminatory practices, like for instance discrimination against single women or against homosexual couples, there's a lot of cross-border art tourism, so that can put a strain on different systems, and accessibility gets lowered due to the affordability. Why do we need art clinics? Why do we need art in general? Well, art is already being used, but there's infertility worldwide is 8 to 10%, which affects 50 to 80 million people. This affects developing countries negatively. In some areas of sub-Saharan Africa, up to a third of couples are infertile, and this could be due to secondary infertility, which is exposure to infectious diseases, which requires education, but that doesn't minimize the need for art. Also, different areas like India and Bangladesh, women are ostracized because of infertility, and that can lead to a lot of different social-cultural problems. Chemotherapy treatments and other types of treatments for different types of diseases can cause ovarian damage, which can lead to infertility, which can be devastating for some women, so art can really help certain people. And also in the US, more women are waiting for motherhood, so things like cryopreservation are being marketed to healthy women. The Nurses Association position statement on reproductive health basically advocates for patients' rights, but it also advocates for nurses' rights to refuse services, and it reaffirms, the nurse's ethical obligation to ensure that patient safety is maintained and to avoid patient abandonment. My recommendations for the process of ART is an increase of regulatory practices. Right now, all that's really required from ART clinics is that they report success rates, and a lot of them do it by different methods, so there needs to be kind of a standards of success rate. So some do it by pregnancy, some do it by live birth. It just depends on that particular clinic's preference, which makes it difficult to compile information, and that makes it hard for nurses because it's our job to provide education for patients so that they can truly demonstrate autonomy. And then also accessibility. A lot of these procedures are, particularly in the United States, are not affordable. Other countries, like in the UK, have public health care policy that allows for reimbursement or complete coverage of these procedures. But even in those countries, there's a lack of information, lack of education, lack of data collection, which makes it difficult to provide patients with the best options. And then all of this is very important because, as you can see in the images here, ART cycles are increasing in developing countries, and here as well. This is actual single embryo transfer in fresh ART, whereas this one was frozen and thawed ART cycles in different parts of the world.